Welcome to the second video of the series related to clinical teaching in health professional education. My name is Mohammed Hassan Taha. I am the director of the Medical Education Center and the coordinator of the Master of Leadership in Health Professional Education, and we are producing these videos for master students in health professional education. The main aim of this video is to introduce you to the settings of clinical teaching, such as bedside teaching, teaching in the wards, teaching procedural skills in lab, and outpatient teaching. The video also will introduce you to the models of clinical teaching, and finally we will end up with explaining the importance of role modelings and professionalism in clinical teaching. We'll start with bedside teaching. It is very important when we think about bedside teaching to consider the following tips and principles. And bedside teaching is considered the most effective methods for integrating clinical skills, communication, and professionalism in a single encounter. And in bedside teaching, we should consider the following: patient consent and ethics. Before you start bedside teaching, you have to introduce all team members. Explain the purpose in a simple language. Obtain explicit consent from the patient. Ensure confidentiality and avoid sensitive discussion at bedside setting beside the patient. The other important thing that needs to be considered, it's very important to set the objective clear before starting bedside teaching. So you have to define a focus objective and make sure to align clinical competence to the learner levels, because most of clinical educators, they have different roles. They are teaching consultant, teaching specialist, residents, and undergraduate medical education. So the level is very important. And it's very important also to share with the learners before entering the room for bedside teaching. For example, you may inform the learner that today we'll focus on cardiac auscultation and the differential diagnosis of the murmurs. It's very important then to think about the model that you will use, whether 1 minute perceptors or SNAP model, and we'll be describing these models during this video. It's very important to maintain engagement throughout the session by assigning clear role in terms of history taking, examination, summary, and please ask targeted questions. What are you looking for? Encourage critical thinking aloud and avoid long explanations or passive observation from the learner. Whenever you think you lead, you plan for bedside teaching, we must consider patient-centered environment. What do you mean by that? We mean we should prioritize patient comfort and dignity. And we should limit the time at bedside teaching as much as possible. What I mean by that, we can keep all discussions that is unnecessarily to be done beside the patient and do this discussion in our offices, rather than staying maybe for 1 hour or 2 hours beside the patient. And we should avoid technical jargon with the patient. This is a very important thing that we have to consider. We should involve patient in bedside teaching setting, and we should confirm the findings and explain the plans simply. It's very important to think about the clinical reasoning when we teach students with patient. And very important to link the findings with the interpretation, with the decision, highlighting the professional diagnosis and differential diagnosis and the models. And we can use it in a simple way that this murmur suggests this because of this. One of the important tips that feedback should be timely with bedside teaching. And when we say timely, this should not be in front of the patients. Some of the practices, the consultants give feedback to students or to residents in front of the patient. And this may create issues when those students or residents come back again and take a history or treat the patient. It's very important to provide time for reflection for the learners following the feedback. And in a simple style, you can ask a question: what did you learn today? What will you do differently next time? This is very important aspect related to bedside teaching. Let us explore the other setting, ward round. And ward round serve both patient care and teaching. So service demands overshadow teaching without intentional planning. In ward teaching, we have to set expectations very clear to the learners and assign the role. We have to be time conscious. And if you have many cases in the ward, we have to prioritize cases with rich learning value. And we have to plan for 1 to 2 maximum teaching moment per round, explaining learning values in a concise and be directly relevant to the patient. And we have to use the probing while teaching at ward setting, such as, what do you think is going on? Why do you suggest that treatment? And so on. Involve the patient is very important. As educator, we have to summarize the plan to the patient in a simple term and using a very good model with communication, while keeping in-depth technical discussion outside the room. This is very important. It's very important to consider the debriefing, and we'll be talking about the debriefing in detail when we come and talk about simulation. So after each patient, highlight one learning point or give one feedback comment. We should not forget to comment on a good presentation. And we have to correct misconception here. And this is very important to be done timely. The third setting is the outpatient clinical teaching. And in outpatient clinical teaching, we have a tight schedule, short encounter, and we have a dual demand, service and education. This creates tension and challenge. So maybe using 1 minute per chapter model or framework is better for teaching, and I'm going to explain the model in the next stage of this video. We have to orient the learner, explaining the clinical workflow at the start. For example, you see this patient first, I will see another, then you present to me. You have to introduce the student to patient and explain the role of the students to the patient and set clear expectation. We have to use one perceptor model, and I'm going to talk about it. And you have to teach during routine task. For example, while writing prescriptions or waiting for the results? What alternatives could we use if this patient were allergic to this drug, for example? Because many teaching points add up without slowing you down. It is very important here to foster independence, and here will help in developing the deliberate practice. Let the student take history and do focused exam independently. Then they report to you. This will help confidence and will help to build confidence and autonomy for the learners. And also will free the trainers to see another patient simultaneously. Again, debriefing here is very important, and we can do the debriefing at outpatient clinic by asking what went well, what was the challenge, and it's very important here to share one teaching point. If no time, after each patient, you may think about 10-minute wrap-up at the end of the clinic at bedside teaching. Now, we'll go to the fourth setting related to clinical teaching, teaching in the lab. So, lab is considered as control environment and very suitable for procedure skills, deliberate practice. Because the learner will see will do one thing, and refine with feedback. One of the very nice models, and with a very good evidence supporting these models, is called Python models, 4-step approach. You start with demonstrate, deconstruct, comprehend, and perform. Let us explain them in detail. You demonstrate as a trainer, you perform the skill in real time at normal speed without commentary. And the learner should watch you while doing this procedure. In deconstruct, you repeat the procedures slowly now, explaining each step and key point, and breaks the skill into teachable sequence. The comprehend phase, in which the learner verbalize each step aloud, inform you that you are doing this and this and this while you are performing. And the main aim of this stage is to confirm understanding before learner touch the patient. Finally, perform stage, the learner perform the skills step by step. Teachers guide initially, then reduce support gradually. And repetitions build muscle memory. Repetition also help to enhance the deliberate practice. These very important additional skill tips: provide immediate feedback, emphasize patient safety and rationale, and encourage reflection for lab. These very important things that need to be considered. Now we'll go to the third video in the series related to clinical teaching. We will stop here, and please reflect on your teaching style at the different settings that we explain in this video: bedside teaching, outpatient teaching, teaching at work, and teaching at lab, and think about what are the things that you are going to do differently after watching this video. The next video in this series will be about teaching models that you can use, and we will cover the professionalism and the role of the hidden curriculum in clinical teaching.